Hello, everyone. Welcome to another episode of podcast. I'm Shalini Sundarajan, and I have here with me Dr. Chris Noyes from Texas Family Medicine. Thank you for being here with us today.
You're welcome. I'm excited to be here. Thanks for inviting me.
So, Dr. Noyes, you actually went through this Fresh Start program. Can you tell us a little bit more about what the program entails?
Yeah, I worked with Kimberly Sjogren, and she was so helpful getting me started back with eCW. It's designed for new practices, just starting out, not necessarily a doctor joining a larger group, but a brand new practice starting up to help really reduce your upfront cost, because as anybody who's ever started a practice knows, money's short. I mean, money is always short, but starting up, there's so many other expenses, and to have a major expense also of an EMR is just one more thing that's hard to overcome. And the Fresh Start really makes it manageable, and it scales up as you get busier. It's a cost per visit. So as you get busier, there's a little bit more cost, but it's such a small incremental cost that it makes it easy to handle that bite.
Yep, that's wonderful. Now, I also hear that, you have used other EHRs in your past and also eClinicalWorks, and now you are back with eClinicalWorks. Can you talk a little bit more about, chronologically the EHRs that you used and as to why that change has happened?
Sure. Yeah. When I first opened in 2003, I used a company called Practice Studio, and I was happy with them initially, but over time I realized that they weren't really evolving or changing their product. So at the time, that was when e-prescriptions and patient portals were first coming out, and they didn't have it. And it was just the same product over and over and over. So we searched and settled on eClinicalWorks. And so I switched to them in 2009 and used them for over 10 years. It was great. Everything was I was really happy with them. We were self-hosting on the server in our office. And then right before the pandemic in early 2020, we merged with a larger group. And they were also using eClinicalWorks, but they were on the cloud. So it was a little bit different, but all the features were the same. And our data just flowed right in, and it was perfect. And then late, sort of the second half of 2023, after I made the decision to leave the group and go back out on my own, they also at the same time switched to Athena. So I sort of approached it as hey, I've been on eClinicalWorks for over 10 years. I don't know what else is out there. This is a good opportunity to try a different product and see if it's better or worse, or do I like it or not. So I had about 5 months on Athena, and I'm happy to say that I love eClinicalWorks. There's a lot of things that I really like about it that are better than Athena, in my opinion.
That's really good to hear. Now, how does eCW or eClinicalWorks compare to the other EHRs that you've used in the past?
So the support is a big one. Like the first one that I mentioned, the Practice Studio, I didn't really have the support and the training that we had with this. With comparing eClinicalWorks to Athena, the customization is so much better with eCW. Things that you can do in the HPI section, or just really any section of the chart. The patient portal customizations of things you do or don't want, how you can check in with the kiosk, different features that you can turn on or off as needed depending on what your practice needs, what your patients use and like. So it's really that customization that really makes a big difference.
That's wonderful to hear. Now, I also hear that, your patients use the patient portal pretty extensively, and you find it very useful. So can you speak a little bit more about that?
Sure, yeah. We really encourage our patients to use the portal because it saves us on our manpower. And no practice has enough people to call everybody back. You can't answer phone calls over and over again. You just can't handle that volume. So we try to leverage the technology that eClinicalWorks has to help us reach more people faster. So with the portal, we post our patient results, our lab results, our imaging results. We'll send them messages. If we get, say, a message from another physician that we need to follow up on, we can send them a message in the portal. And then they can review that asynchronously at night. They can get that message. They can reply to us. The next morning we get back in the practice and we see their response. So we can communicate pretty quickly, sort of like email, but all in a HIPAA compliant, secure manner. And it all flows right into eCW. It's well documented, which of course is important from a legal compliance point of view. So it just all flows and fits together like a perfect puzzle when you have it all fit at the end.
That's wonderful. Now, I think we also spoke briefly, and you mentioned that you use a little bit of televisits or telehealth at your practice. How has that benefited you?
Well, it's for me as a physician, it's sort of the same as having an in-person visit. It's just better for patients, really. Sometimes people just, I don't know, something came up. I had a patient a couple weeks ago who had a contractor in his home, and he had an in-person visit, and he couldn't leave because the contractor was there. So we just flipped it over to a televisit, and so we were able to maintain that appointment. He got what he needed, and we didn't lose out on an opportunity to see someone. Sometimes they're sick and don't want to come in, or just various reasons. Sometimes we have a lot of adolescents who go away for college, and they're out of state even, and they can still see us for televisits if they need to follow up on something. So a lot of different scenarios where people will want to use a televisit, and it's fine for us.
That's great. Now, last question, probably the most important question. Why do you believe eClinicalWorks is the clearest choice for your practice?
Well, we already spoke about the customization, so that's a huge one. The support is huge, but being here at the national conference, which has been awesome, I'm really excited about all the innovations that come. And this is really what set eClinicalWorks apart in my mind over all the years, because they're constantly coming out with new things. They're ahead of the curve. I think other programs sort of copy the ideas from eClinicalWorks. With the AI that we have and the surveys that we have and how it integrates in with different sections through Helo and whatnot. I'm just really excited about all the new stuff that comes out, and you never done. It's sort of like medicine. Medicine's always changing. eClinicalWorks is always changing, but always for the better, always bringing more things in. So it's just that innovation and how they're always bringing new things to make our life better, make charting easier, make it more efficient, make the patients' lives better, just cutting costs for patients with the value-based care modules, et cetera. It never ends. It's always something new and better and improved.
That's wonderful to hear. Well, Dr. Noyes, thank you for being here. Thank you for being here at our conference, and thank you for sharing your insight with us. We really appreciate your time. Thank you.
You're welcome. It was my pleasure.
Thank you. And thank you all for tuning into today's podcast. Thank you, and have a wonderful evening.